everyone, my name is Jalen Barron and I'm your current Miss Pennsylvania's Outstanding Teen 2021. The Pancreatic Cancer Network and the Purple Stride Philadelphia organization has afforded me the opportunity to interview caregivers, volunteers, survivors, and anyone that has been affected by pancreatic cancer. November is Pancreatic Cancer Awareness Month, and as Miss Pennsylvania's Outstanding Teen, my social impact initiative promotes and advocates for those that have been affected by this disease. I want to thank the Pancreatic Cancer Network and Purple Stride Philadelphia for allowing me to interview all these individuals. So, without further ado, let's get started. Jalen Barron, and I am Miss Pennsylvania's Outstanding Teen, and I have a special guest that I will allow to introduce himself.
Hi, my name is Burke.
Today, so we are doing a survivor interview for PanCan, and I'm going to start off with my first question. So for what are you most grateful for, and what are you doing to pay it forward in your experiences of being a survivor?
What I'm grateful for is actually surviving pancreatic cancer. I do understand that the survival rate for pancreatic cancer is very, very low. And just to survive it I'm just very thankful for. And what I'm doing just to pay it forward is just living life a little bit better and just, being more grateful that I'm able to see family, friends, and now I just realize I want to kind of like be an advocate for pancreatic cancer because I do know the struggles of having it. Again, when my dad passed away from pancreatic cancer, it's one thing to have it, but when someone has pancreatic cancer, you don't understand what they're going through. But to actually go through it, you actually have a better understanding of what they felt. But fortunately, I was able to survive it.
Wow. And that's very interesting to hear, especially being a child that saw a parent go through pancreatic cancer like yourself, and just seeing all the medications and chemotherapy that they go through. But to hear your experiences going through it as a patient and now a survivor is really interesting, especially for our viewers to hear about. But I wanted to ask you a little bit about your diagnosis and some symptoms that you saw early on that caused you to go to the doctor and realize that something was wrong.
It was just maybe one day I was actually working, and I felt a slight pain in my my abdomen towards towards the rear.
Yep.
And at the time I was a heavier guy, and I just figured that maybe I had something I shouldn't have been eating, and I'm paying for it. But the pain actually lasted for about a week.
Wow.
And I said to myself, a stomach ache is not supposed to last that long.
For sure.
When I went to urgent care, they said, "Oh, you have a bowel blockage." I said, "Oh, okay, that's fine. At least it's nothing serious." Took some medicine, didn't feel anything. Within 2 days, it came back.
Wow.
The stomach pain came back, and I said, "No, I don't think this is, bowel blockage."
Yeah.
I didn't think anything of it. The dangerous part about it is the pain is not bothersome. It's annoying, but it's not bothersome where you really have to go see someone. So you can kind of say, I'll just deal with it and just forget about it.
Yes.
What ended up happening, I kept telling my wife, I said, "Sweetheart, my stomach hurts, but I don't know what it is. It's been hurting for about maybe a good 2-3 weeks now, and I don't understand what's going on. Also, I'm losing weight, and I don't understand where it's coming from." I said, "I like it, don't get me wrong." But
yes,
because I was at the time I was 315 pounds.
Wow.
And I was losing weight. I think it was like maybe 7 pounds a week.
Oh my goodness.
And the next thing you know, and pancreatic cancer was the last thing on my mind, because I remember my wife saying something about my dad losing weight. And then it just kind of like came back like an epiphany. It just came back, and I was like, "Oh my God, I hope this ain't what I think it is." Went to the doctor. They said, "Oh, you have a lesion around the pancreas." So automatically we thought the worst, like, "Oh, this is not good." And then my wife told me, like, "Anj, just calm down. It could be, you never know. Just go to the doctor. Let's get a biopsy." Got the biopsy. They informed me that there was a tumor a size of a grapefruit on the head of my pancreas, but they didn't know if it was benign or malignant. After they did the biopsy, I was at work getting ready to head out to Harrisburg. And I got a call from my doctor maybe 40 minutes before I was getting ready to depart with my train.
Mm-hmm.
And he says, "Oh, Andre, are you at work?" I said, "Yeah, I'm at work." And he says, "Oh, well, I'll just call you tomorrow." I said, "No, no, no. I've been waiting on your call all week.
Mm-hmm.
Please, whatever it is, I just want to know."
Of course.
And then assessed me, told me, he said, "Andre, yes, you've been diagnosed with pancreatic cancer." So I
Mm-hmm.
said, "Okay." It didn't hit me until I called home.
And now, how long were you in treatment before you were thankfully allowed to not receive it anymore and you were in remission?
Well, I was done with radiation in August of
Okay.
2019. And right after that, October 1st, 2019 was when I received the Whipple procedure, the surgery, which
Yes.
they cut out 30% of my pancreas and they took the gallbladder that was gone. And they had a doctor that just redirect so many veins. He explained it to me. I didn't know what they were talking about. He explained it to me. I
Yes.
said, "Okay, do what you guys got to do."
Mm-hmm.
And it was 11 and a half hour procedure from what I was told.
Mm-hmm. Yes.
Um, it was very long, but again, I'm not sure if you know Dr. Reddy from Fox Shakes Cancer Center. Did a
Yes, I am
phenomenal
familiar.
job.
Mm-hmm.
Yeah, phenomenal job. I was very comfortable with him. Um, and he told me, well, there's some people that, when they have the surgery, it takes some time for them to go back to work. And it only took me 3 weeks to get up and go back to work.
Wow.
So
Congratulations on that one. That's huge.
thank you.
Yes. So
Mhm.
I want to close out. You've done a phenomenal job telling your story and really conveying it to our viewers here. But what's your biggest advice for people who are symptomatic or are facing pancreatic cancer? And what can you give to them after experiencing it from the survivor aspect, but also being someone that has known a close family member go through it?
It's a cliche statement, but it works. Stay strong. Think positive. If you have family, um, let them be around you. Um, my biggest thing, what I've learned is the medicine works.
Mm-hmm.
What also works is love as well. Because I couldn't do it without, my wife, my brother, my coworkers, my friends, because I told, and this is from my dad. My dad said the same thing.
Mm-hmm.
Andre, don't treat me as if I'm ill. Treat me as if I was well.
Wow.
Because he didn't want me to cry or didn't want me to do anything because it would make him sad. He said, treat me as if I was healthy. So I said it to others. Don't look at me as a cancer patient. Look at me as Andre Burke. And everybody did that for me. And if you are diagnosed with pancreatic cancer, like I said, I know it may look grim, but stay strong. Please, if you have family that love you, let them be around you, let them comfort you, because that's one of the best medicines that you can have.
Wow. Incredible words. And I appreciate you sharing, especially being a caregiver or had been a caregiver myself. I really wish I would have earned or received that advice early on of just you have to treat that patient like a normal person who is going through something tough in life, but there's still a normal person that wants to be loved and treated the exact same. So I really appreciate that. But Andre, thank you so much for sharing your story. I hope all the viewers enjoyed this video and I hope to see you later on. So thank you so much.
Thank you so much.